we do know that the vaccine is safe and effective in preventing the recipient from getting COVID, but we still can't say for certain yet whether it prevents transmission from the vaccinated person to others.
Hi, I'm Lynda Pond. I'm the president of Oregon Nurses Associations. I'm really happy to be here today with Jesse Kennedy, who is from our nurse practice. He is a nurse practice consultant for Oregon Nurses Association. And we are here to talk about COVID-19 vaccines with you. Jesse is a wealth of information. He has been sort of our go-to point guy since the beginning of COVID. He does a lot of research and keeps on top of the latest information. So I'm really happy that he and I can have this conversation today. Jesse previously served as the president of the National Student Nurses Association and as a director at large and with American Nurses Association. And like I said, welcome, Jesse.
Awesome. Thank you, Lynda. Happy to be here.
You and I've had multiple conversations over the last several months about COVID-19. And today what I'd like to know about from you is thousands of Oregon nurses and healthcare workers have received their first dose of COVID-19. And we're even seeing some nurses in the second dose phase to complete their inoculation. Where are we in Oregon's total rollout?
Yeah, so that's a great question. I think the biggest component of that is that the numbers are always changing, right? Currently, we have about 150,000 vaccines that have been administered throughout Oregon, with about 13,000 people having received both of the doses. And although we really don't have the hard numbers of what vaccines were actually delivered to Oregon from the federal government, it was anticipated that we would receive about 218,000 doses by the end of this week. But as we've heard in the news, there's a lot of delays and changes that have happened as far as the delivery and the ability to produce as much as we had anticipated. But it's important to remember that both the Pfizer vaccine and the Moderna vaccine require 2 doses, as you mentioned, to achieve that 95% efficacy rate. So some of the facilities are holding the second dose in reserve for those who have received their first dose to make sure that there's supply for individuals to receive both doses within the requisite time frame. And the 2 doses the 2 different vaccines have a slightly different time frame as far as when that second dose needs to be delivered, but they're still pretty similar. And we've seen that the supply has been much lower than expected. We still don't have those hard data points at the moment, but currently those vaccines are being administered by health departments and pharmacies that are contracted with the federal government. There's also been several vaccine clinics set up across the state in collaboration with our county health departments to vaccinate first responders, healthcare providers, rural and tribal communities. And actually, I believe you joined ONA members and staff from across the state to take part in a couple of those vaccine clinics, right?
Actually, I had this fabulous opportunity fall into my lap to participate in the vaccine clinic for the Lane County first responders. And it went really well. We were doing the Moderna vaccine. We vaccinated, I want to say close to 1,200 people in a week and a half's time. Yesterday was our last clinic day, and I about had a kitten when I pulled up and saw a line around. This building that we're doing this in is a pretty good sized building, and the line was the length of the building, and I was like, holy moly, we're going to be busy today. It's been great. It's been really fun. And what I really loved about it is the enthusiasm. I mean, people that, for the most part, that are coming to get their vaccines are so excited at this opportunity to sort of like, maybe now there is a light at the end of the tunnel, and they're just like, God, we can travel again, and we can maybe, hug our parents. And I think that was the one thing that I heard the most is hug people that I love, and get to spend time with people that I love. There were a couple of people there that were like angry that they had to get the vaccine because evidently it was a mandate from their employer. And we had a good conversation about it. And by the time we were done, they said, yeah, they'll come back and get their second dose, because when they first sat down, they're like, I'm not getting the second dose. I'm just doing this to so I feel really good about that opportunity. I do think at some point in time during this conversation, what I would like to talk about a little bit is a lot of nurses have reached out to me and said, how can I be involved? And so hopefully you have some information on that that we can share with our colleagues.
Yeah,
Um, but before we go there, why don't you talk a little bit about where we're at and who's next up on the list, you know, to get the vaccine, and what's the next phase of the rollout of the vaccine going to look like?
sure. So right now we're in what they're calling phase 1A, which is basically all healthcare personnel. And the term healthcare personnel can be a little bit vague, but basically what it means is anybody who works in a healthcare setting at all, such as nurses, dietary personnel, administrators, environmental services, interpreters, tribal healthcare, and it also includes residents and staff at long-term care facilities. This and also folks with intellectual disabilities and their caregivers. The next phase, once 1A is completed, or as we're moving towards the completion of 1A, would be phase 1B, which includes frontline essential workers such as teachers, correction officers, postal employees, folks 65 and older, and likely incarcerated individuals. Then we move into phase 1C, which includes all other essential workers, anyone 16 to 64 with high risk medical conditions. And also it's important to note that a lot of the components of each of the individual phases are going to be changing slightly as we move forward, because we have the COVID Vaccine Advisory Committee, which is composed of several folks throughout the state that are providing recommendations to Governor Brown. And I'm sure we'll see updating of those populations of these groups as we move forward. And then once phase 1C is done, we would move to phase 2, which is basically everyone who doesn't have a high risk medical condition. They're pretty.
Can I ask you a question?
What's that?
Sorry. Can I ask you a question about phase 1A, just for clarification? That's acute care facility healthcare workers, not healthcare workers that work in medical offices. Because I work as part-time as a nurse in an OBGYN office here in Eugene, and my colleagues in the office I work in have not been able to get their shots. The docs have been able to get their shots because they're at the hospital doing deliveries. But the nurses and the staff, the secretarial staff that work there, have not been able to get shots. So, and it's my understanding that that is true of Oregon Medical Group clinics as well. So when we're talking about healthcare providers being in phase 1, it's not blanket healthcare providers from what I understand. Is that true?
Yes and no. So it's kind of fuzzy. So the way that it's working in most places is that when they thaw out the vaccine, generally there's 10 doses in the minimum amount that they have to take. So they have to find 10 folks to get that vaccine. And usually it's people from 1A, but if they only have, 6 or 7 people that are able to get the vaccine within the thaw time, they're going to give those other vaccines to anybody else who might be in 1B or 1C. So the goal is really to try to get those folks who are most at risk of being in contact with people who have COVID-19 and be in situations that are high risk, like aerosolizing procedures and those sorts of things. And as those people are vaccinated, start to move out to more of the outpatient clinics, like you're talking about, situations where there's a less likelihood, but they're still at risk, and we still want to make sure that we're getting to them. So there's really kind of a fuzzy area right now between what is 1A and what is 1B, and when we're moving into it. So some folks are moving ahead. So like, we want to make sure that we're reaching those folks who are the most at risk. So there's a lot of work being done in the tribal communities to make sure that we're trying to reach all of those areas where they're most at risk and have a lot lower level of access to healthcare. So the 1A, 1B is really kind of a blurred line right now. And I think, as we'll probably see in the coming days, coming months, the Vaccine Advisory Committee, along with Governor Brown, are going to be moving those populations within the groups up and down quite a bit.
Okay. Do you see us going sort of the Indonesian model, where they are really focusing on not so much the elderly, but on the younger people, the people like in their late 20s, early 30s, that are the people that are out there doing a lot of mingling, people that actually have jobs that support the economy. In the Indonesian countries, they have made it their focus to vaccinate those folks first, because that is sort of like they're the spreaders and they're also the money makers. So do you see President Biden, when he is seated in office, maybe shifting gears to that direction at all?
I mean, it's entirely possible. I mean, I haven't heard that argument made by the CDC or the FDA, but I do know that the main factor right now, as we were talking about earlier, is just that we really don't know exactly what supply we're going to have. So it's been really difficult to prioritize who's going to be in each of those phases when the amount of vaccine that is being delivered has been a lot different than what we anticipated. So it's entirely possible for that. But I think the goal, at least as far as what I've heard from OHA, from Oregon, and the Vaccine Advisory Committee is to mainly focus on first the folks who are going to be providing care for individuals who might have to get hospitalized, might have to seek care, and then to try to get those people who are most at risk. And so that could change, but I think right now their focus is really on trying to identify what those populations are. They're going to be most at risk for a multitude of reasons, but really to focus on them first. And obviously, as we said, that could change, but.
Right, right. So what's been the response from nurses who've had the opportunity to get vaccinated?
Well, I mean, there's been a lot of interest, a lot of people asking where they can sign up, a lot of people asking how they can help administer vaccines. Obviously, there's going to be a lot of questions, as we would always expect from a science-based profession like nursing, because as nurses, we follow science and evidence in our practice, and nurses are always eager to learn more about the safety and efficacy of the COVID-19 vaccine. And I would say, if you have a chance, please read the clinical trial data from the vaccine trials. They are shown to be entirely safe and effective in preventing COVID-19. We've also seen, on the downside, a lot of registration sites crashing due to overload of traffic. So there's been a difficulty in identifying those individuals that are not only eligible, but interested in making sure that they're in line. But we have seen a pretty relatively quick ramping up of the rollout so far. I think it was like 60,000 something was the number that was posted by OHA just a week ago, and now we're like 130,000.
Mm-hmm. Yeah, so you talked a little bit about the registration sites crashing. What are the registration sites? Can you explain that to people? How they get on, how they get to register to get, and I'm assuming to get a vaccine?
Yeah, so right now in phase 1A, as I had said, most of them are being provided by most of the vaccines are being provided by their employers. However, there are lots of smaller, like long-term care facilities, for example, that they don't necessarily have the infrastructure set up. So within those places, the county health departments are really taking the lead in identifying who those people are and then also giving them the vaccine. So most of your county health departments will also have a link on their page so that you can identify. Generally, it's for those employers to identify that they need help with that, and that gets them on the list, and they contact everybody who works there and all that kind of stuff to make sure that those folks are getting on there. As far as individual sites, like within individual facilities, we've seen those sites crashing just because there's so many folks at some of our facilities in the state where they're trying to sign up, and traditional traffic on those servers is just nowhere near what we're seeing.
Right, so they don't have the capacity. Okay, thank you. I'm glad you keep bringing up the science, and I think that's fabulous. These vaccines were developed quickly to defeat a pandemic, and this is a question that a lot of the people that I've been injecting have brought up. What was the development process, and what do we know about the standards it was held to?
Sure. So yeah, another great question. I mean, the development process was essentially the same as the development process for any other vaccine. really, I would say speed in this is really because, and progression to the clinical trials is really because of the mRNA nature of the vaccines, the messenger RNA nature of these vaccines, rather than the older method, which was utilizing actual components of the pathogen, which meant that we had to grow them, to identify the individual components within those smaller pathogens. But both the Pfizer and Moderna clinical trials had more than 30,000 participants. Special attention was paid to make sure that there was an equitable inclusion of BIPOC participants, which we've seen are at a much higher risk. And the trials were also careful to include participants with other comorbidities, other autoimmune disorders. And while the vaccines are only being offered under an EUA right now, or an emergency use authorization, they still had to meet all of the regular benchmark requirements for vaccine safety and efficacy. So the participants were followed up in a longitudinal study, longitudinal fashion, for at least 3 months before the EUA was even considered. Whereas authorization for the FDA full approval requires at least 6 months. So we're getting there. But the bottom line is that the COVID-19 vaccines that are available in Oregon, the ones that have received an EUA, passed all the normal safety standards and have been shown to be entirely safe and effective. I mean, they can protect you and those around you. And I think we in Oregon have an added benefit that Oregon joined Washington, California, Nevada, Colorado in the Western States Scientific Safety Review Work Group to independently verify the safety and efficacy and clinical trial results. The Western States Scientific Safety Review Work Group. There we go. Come up with an acronym. Everything interesting, right? But anyway, they worked hard at reviewing the data independently, and they ultimately concluded unanimously that both the Pfizer COVID vaccine and the Moderna COVID vaccine are safe and effective.
Great, thank you. So, you talked a little bit about the BIPOC communities that were included in the trials, and we know that COVID-19 disproportionately affects BIPOC communities. They've been the hardest hit by COVID-19 and are often marginalized within corporate healthcare. So what does the research show about the safety and efficacy of COVID-19 vaccines for BIPOC people? I know that President Grant of ONA, he participated specifically because he is a Black man and he wanted to really support the message to the BIPOC community that this vaccine is safe for their community. So would you like to address that?
Yeah, I mean, the fact that the BIPOC community is affected at a much higher rate is entirely based on every bit of evidence we've had for a very long time. Right. There's a whole lot of rationale as to why that could happen. Less access to healthcare, historical inequities or historical events and travesties really that have led to a distrust with the medical healthcare system. But because of that impact, there was a lot of research that was done in the lead up to the clinical trials. So there was much stricter standards for the demographic composition of the clinical trials than have ever been required before, with metrics that required representative portions of Black, Indigenous, Latino, and other groups that are at higher risk. And the vaccines have shown to be safe and effective for those communities as well. So there's no difference as far as the efficacy and the safety from the clinical trial perspective and the hard data that we have.
That's great. Let's hope that that level of respect for the BIPOC community continues, and continues to grow because it's too long in coming. So moving on, a lot of my friends and family members and the people who I've been injecting have asked me about potential side effects of the vaccine. I know for myself, when I got mine, I didn't even feel a sore arm. I mean, which was because I was all geared up to like, my arm's going to hurt like, what, because it always does when I get the flu shot. And I was like, nothing's going on, so that was pretty cool. Right. What can you say about what people should expect?
Sure. Well, so far, we've seen about what you would expect from most vaccines. The most common reported side effects are fatigue, body ache, and low-grade fever that last a couple of days. We have seen more reports of those with the second dose than with the first dose. So that is something to be aware of. But most of the side effects are really caused by your own immune system ramping up to react to the vaccine, right? So with any medication, there's always going to be a chance for an allergic reaction. But there doesn't appear to be any higher incidence of allergic reaction with these vaccines. It's been between 1% and 2%, which is pretty consistent with every vaccine that we've really been able to study over the decades, really, especially since we moved away from a lot of the components that used to cause a lot of the reactions, the aerosol and all that kind of stuff. But always, if you have had an allergic reaction to a vaccine or any other injectable, definitely want to make sure to talk with your healthcare provider before you get vaccinated. But being allergic to one thing doesn't necessarily mean you're going to be allergic to another thing or to this vaccine in particular. So it's vitally important, if you have any concerns about that, you talk with your healthcare provider before so you can make the right choice.
Great. I know that one of the things that we have seen in the clinic that I'm participating in is that people that have been exposed to, that have had COVID, even a couple that were, one of them was like more than 90 days out from getting his vaccine. When they got the vaccine, not only did they have the sore arm, but the lymph nodes in the arm that they received the vaccine in swelled up pretty significantly, and they had severe fatigue for like 48 hours. And we got that report from 3 people out of the 1,000 plus that we vaccinated. So I think that that's good for people that have had COVID to know that, yes, you might have a more severe reaction to your first dose, but that should not preclude you from getting the dose, especially if your healthcare provider says it's what you need to do.
Definitely.
So we've talked a little bit about the short-term side effects. What can we share today about the long-term side effects? Because that's something that most people are like really afraid of, how much brain damage am I going to have kind of stuff,
Right. So the data that we have access to is very promising, really. Shows there's little risk at all of any long-term side effects. Vaccine development trials are all required to follow the research participants for a minimum of 60 days. As we had mentioned, we need to get at least 6 months before we can get to the FDA approval process. But those numbers are because side effects most commonly occur within the first 60 days. So we would think they would be caught in those clinical trials. That's another reason why they had to go out to the full 3 months before they could apply for the EUA. And we didn't see those. We don't know for certain that there's not going to be an additional long-term effect, but we haven't seen any long-term effects in other mRNA vaccines. So mRNA vaccines are relatively new, but they're not new. They've been around for quite a while. These vaccines cleared that mark. They completed the additional benchmarks that the CDC set, the FDA set. And I think that really gives us confidence that, so far, based on everything we've seen, they're safe, but the data really can only follow the length of the time that the disease and vaccine have been available. So talking about long-term potential side effects is an important piece for sure, but I would definitely encourage nurses to put that information side by side with the long-term effects of getting COVID-19, which nurses and frontline healthcare workers are definitely at a higher risk for. We can't evaluate our long-term effects in a vacuum. Every day we're gathering data, learning the disease itself, learning more about it, and finding that, frankly, it's a lot more damaging long-term than we thought. There's been a lot of research that's come out recently showing cardiovascular damage and pulmonary damage to folks who were healthy athletes, especially that were healthy prior to getting COVID, but now could potentially be in a place where they have long-term effects of COVID for the rest of their life. So it's really important to weigh the potential side effect versus what we're also seeing as a side effect of getting COVID.
Right. I've also heard that there's some conversation happening now about it can bring on early onset Alzheimer's. Is one of the latest long-term side effects that I've been hearing kicked about. And that's really, all of it is so scary and sad. Give me the vaccine any day.
Yeah, definitely.
So You talked a little bit about people with allergic reactions should consult their healthcare providers. Is there anybody else that should consult their healthcare provider before getting the vaccine?
I mean, so the main thing is definitely those who've had an allergic reaction to vaccines before. And the other component of that is that there were no pregnant women enrolled in the clinical trials, which is fairly common. I mean, if you're trying something, you don't want to try it necessarily on things that are very hard to measure and while it's going on, right? It'd be very difficult to measure the response of the fetus. But we have seen that other mRNA vaccines have been safe for pregnant women. But with that said, CDC recommends that pregnant women who are at a higher risk of contracting COVID-19 consult with their healthcare provider before getting the vaccine. So they're not really saying either way, but mostly that's because we don't really have the data specific to the COVID-19 vaccine.
Okay, yeah, and I did take care of someone yesterday she brought her 7-day-old baby in with her to get her vaccine. And she said that her doctor and her pediatrician both told her, even though we don't have data, get it. So
Right.
There's a lot of questions about DNA and mRNA. Can you tell us how mRNA vaccines work and why the COVID-19 vaccines use this method?
Yeah, so mRNA is the other name for messenger RNA, but it's a vaccine that basically utilizes a section of the SARS-CoV-2, whatever you want to call it. The specific name SARS-CoV-2, or the pathogen, the virus that causes COVID-19. It's the component of that messenger RNA that is utilized by the virus normally. So the mRNA itself acclimatizes your body's immune system to what it would see when it comes in contact with the virus. Basically, it's injected and then it's transcribed. And this is very different from the old method of utilizing weakened or dead pathogens, which require that a whole lot of the pathogens be grown in the laboratory. Once it's injected, the mRNA is transcribed in what's called a spike protein of the virus. The spike protein is what's on the surface of I'm sure you've seen the picture, right, of what COVID-19 looks like with the ball and all the little spikes sticking out. And that spike protein is what it uses to gain entry into your cell and inject all of its DNA and take over your cell, really. So that mRNA just is transcribed by your immune cells. And once it's transcribed, it's dissolved through the transcriptase. Doesn't remain in your body, but it does create a version of that spike protein, which encounters the surface of the immune cell, and the immune cell recognizes this is not something I want to deal with. This is something that is a potential invader, starts to ramp up your immune system. But with that said, it then can identify that spike protein for every other time it encounters COVID-19 until there's some, potentially some huge change in the spike protein of the virus. But mRNA vaccines have been around for, little over a decade. They're used in some versions of the flu shot. They're used in the Zika shot. They're used in the rabies shot, Ebola, and cytomegalovirus. So they have been around for a while. It's not entirely new, but there's no way for the mRNA to stay in your body and affect your DNA in any way. It's just transcribed and dissolved in the transcription process.
Okay, thank you for that. So a lot of people want to know, can you get COVID-19 from the vaccine?
Well, so the two vaccines that we have now, and honestly, all of the ones that are in clinical trials right now are either an mRNA, like we're talking about, a viral vector, or a protein subunit. None of those contain any of the weakened or live or attenuated viruses or pathogens that we used to see in vaccines. So the mRNA vaccine, as we said, only contains that little bit of mRNA, which is transcribed into the spike unit, or the spike protein. And the spike protein is obviously not attached to COVID, to the full COVID virus. So there's really no way for a person to get COVID-19 from the vaccine. There's literally no possible way.
That's fabulous. That should make people feel better. But the answer to this next question might not. Are you ready? Will they need to
Sure.
get a booster shot in 2022?
All right. Well, that's really the big question, and you're probably not going to like my answer in that we really don't know 100% the answer to that question. So we do know that both of the two vaccines that have been approved with an EUA requires the two doses a few weeks apart to reach that 95% efficacy. We have good data showing that it's safe and effective, but we don't know for sure how long that protection is going to last, because COVID vaccines could be similar to a yearly flu shot, or it could be a one-time immunization, or somewhere in between. There could be a, every 2 or 3 years or something like that. But the fact is, we really don't know. We do know that viruses tend to evolve pretty quickly compared to other pathogens, with frequent errors in their viral replication that sometimes are beneficial, sometimes detrimental, whatever. Sometimes they're a good thing, sometimes they're a bad thing, but for the most part, those strains really haven't changed how the virus operates. When we saw the one strain it was first identified in the UK that showed it to be a little bit more infectious, but it didn't really affect how it operates, how it enters the cell, its effect on the body. It didn't show it to be have any more life-threatening or aggressive tendencies within it. But really, we don't know yet if the virus is going to evolve into a markedly different spike protein, really, that would allow it to trick our cells to let it in. Only time will tell. Hopefully, it'll be a one-time thing, but we don't know.
That's fair. Thanks. We do know, though, that one of the biggest challenges of COVID-19 is that it's an asymptomatic transmission. The vaccine helps prevent people from getting COVID-19, but will it help prevent people from transmitting COVID-19 to other people?
Well, we do know that the vaccine is safe and effective in preventing the recipient from getting COVID, but we still can't say for certain yet whether it prevents transmission from the vaccinated person to others. Most vaccines do help reduce transmission, so we're hopeful that that's the case with this one, and that will be a secondary benefit, right? So protecting the individual who gets the vaccine, protecting anybody else. And we're starting to see a lot of promising data that is true, that it does reduce the ability for that person who's been vaccinated to be a vector, to be a carrier of the virus. But we still don't know for sure yet. And there is a pretty high bar to reach for us to be able to say for sure. But until then, until we can confirm that with certainty, we have to be sure that we're still utilizing source control methods, appropriate PPE, wear your ONA mask,
Right.
make sure that you're protecting everybody.
Okay, so we're getting close to wrapping this up. A couple more questions. What is Oregon doing to ensure people have equitable access to the COVID-19 vaccine? And you kind of touched on this a little bit, particularly for BIPOC communities and other marginalized groups.
Yeah, good question. So the CDC require that each jurisdiction, 64 jurisdictions that the CDC covers, which includes all of the states and territories, and then some of the larger cities have their own jurisdictions. But they were all required to develop plans for distribution that specifically answered how they would ensure equitable distribution. OHA's plan to collaborate with community partners across the state to ensure that everyone has equitable access has been, I wouldn't say it has been perfect, but it has been a really good start to figuring out how we can make sure that we're getting access to the rural communities, to the more remote groups that don't necessarily have the traditional healthcare access that one would anticipate, that I'm sure the CDC anticipated. So the COVID Vaccine Advisory Committee, which I mentioned earlier, it's composed of 28 members from all across the state, with representation from many BIPOC groups and special interest groups all over the state, to make sure that we aren't leaving them out of the conversation. But again, like I was saying earlier, it's an evolving situation, but OHA is really trying to figure out how to work best with community partners, local county health departments, working with pharmacies, working with EMS, trying to find as many folks as we can to not only give the vaccines, but also ensure that there is a culturally respectful, culturally knowledgeable representation of what the vaccine is in our messaging that's going out to all those groups, to make sure that we're providing the best information in a way that is readable by everyone, so that we can really get that equitable access.
Great. So I do want to circle back to that question that I asked at the beginning of this, where the nurses out there that want to help, that want to be part of vaccine clinics, do you have any advice for them on where they can go to sign up and let the powers that be know that they're out there and want to play?
Yeah, so I would 100% recommend contacting your county health department. As we've found, OHA has really delegated most of that local employment, not local employment, but the local enactment of that plan to the county health departments. So they're the ones who are really doing the on the ground work to organize the clinics, to have mobile vaccine clinic groups that are going to those long-term care facilities, that are going to the tribal reservations, that are trying to reach out to the other tribal groups, that are going into the bigger parts of the city, or going to other places that really have no access to healthcare. So definitely, I would say contact your county health department. There are always clinics that are going. I would say for certain, though, that as we ramp up to the next, as we are fully in phase 1B and into 1C, there's going to be a whole lot of folks that need to be vaccinated. So there definitely will be a need for ONA nurses, ONA members to really step up and provide those vaccines. We have many people that are going to need it in 1B once we get to all of our 0 to 12 teachers. There's going to be a lot of needs. So definitely, if you're interested, please reach out to your county health department.
Perfect, thank you. So what are some of the questions we don't have answers to yet?
Well, I would say one that I'm the most happy that was answered is that it is safe and effective. Reading through that clinical trial data was a breath of fresh air for me. It was a huge relief. So we want to make sure that we're continuing to develop that data pool. We're continuing to have those longitudinal studies. I think the questions that I'm still looking forward to answering are going to be really the efficacy of these evolving strains that are coming. We know that they're going to be evolving. We don't ever really know at what point that it might actually change functionally. I think the ability to prevent transmission despite immunity is going to be a big one that we're all going to be trying to follow. I mean, everybody wants to take off that mask, but just because you've got the shot or you're both shots, it's not enough right now. There's not enough evidence to say for sure that you can take off your mask and not do those things. I think we also really have to get a lot more data as far as the efficacy and safety for younger persons. So we have the 2 clinical trials that were approved for the EUA. The one was for 16 and older, the other 18 and older. But we really don't have a lot of evidence yet as far as the younger groups below 16, what size dose, what frequency, if there's any difference. But we really just don't have the data yet. So I think those are things I'm mostly interested in. And then I think the $1 million question right now is how quickly can the vaccines be produced and distributed? And how are we going to be able to anticipate that in a way that we can get these vaccine clinics lined up, make sure that everybody is anticipating when the vaccine is coming so that they can be prepared for it. I think those are really the questions that I have right now.
Okay. So there's more information to come, but given what we know, would you get vaccinated, and do you recommend nurses receive vaccinations when it's available?
Yeah, definitely. Absolutely. I mean, the evidence shows that COVID-19 vaccines are entirely safe and effective. I mean, there's lots of rumors and incorrect information out there, as we've seen on social media from just about everything right now. But as nurses, we follow the evidence, right? So when you see something about COVID-19 vaccines that are a vastly different thing that you've heard of, or even if it's information in general, just make sure that that information is coming from a reputable, trustworthy source like a health department or a government organization or a health organization. And of course, you can always reach out to ONA. You can always reach out to your nurse practice consultant to learn more. I'm happy to send you a whole list of articles and things that would make your eyes go cross-eyed after a few hours. Sometimes you got to take a break and step back. But really, this is the most important step of this pandemic, of ending the pandemic, is to protect ourselves with a vaccine. I mean, vaccines have been really the gold standard of what has advanced healthcare overall and the health of persons. So it's really important that we get to this phase, and I'm really looking forward to it.
Have you gotten yours yet?
No, I'm signed up to. I'm doing some vaccine clinics next week, so we'll see how it goes.
Cool. All right. Well, this has been great. Hopefully, I hope that the nurses out there that have listened found it as useful as I did. And would you like to just sort of highlight where they could go to get more information? You mentioned, reaching out to you guys, but I know that we've got some websites up that they could just go and so they don't get the full vaccination study report from you, but just the highlights. Is there a web page they can go to?
Yes, definitely. So you can go to our ONA website, specifically devoted to the coronavirus, www.oregonrn.org/coronavirus for our coronavirus information that has our FAQs. That has a lot of information on there. You can contact your nurse practice consultants by emailing practice@oregonrn.org. Or you can also go to covidvaccine.oregon.gov, and that has a link to all of those more hefty research things as well. Or, as I said, your county health department to find other trustworthy information. And again, I know it's a lot of words and there's a lot of numbers, and sometimes they make me go cross-eyed, and I've got to step back for a second and come at it again. But if you do have a chance, please read the clinical trial data, because it does. I'm confident that if you do read it, it will alleviate all of your concerns. And again, be sure to wear a mask and wash your hands. Those are the big things, right?
Right. And we'll continue to be for some time to come. So Jesse, thank you so much for your time today. And everybody out there, stay safe. Feel free to reach out to Jesse and ask further questions, and get your COVID-19 vaccination when it's available to you. Do it to protect yourself and the people around you. Thank you so much for your time.
Thanks.